if you're interested in knowing where that NAC is available, that has been that is qualified, that it has tested and made sure it has the degree of active ingredients that they say it does, because none of the local ones have a consistency and the percentage of the active ingredients. So the trial that we're doing through the NIH gets their NAC from Italy, and it's a pill form, but the NAC from, they also, the one thing they do have is an effervescent pill that you can dissolve and drink, is one that they gave me the website for. So if you don't plan on doing a trial and you want to get that website, I can give you the website to get that, or where to order it from Italy, which is the one that they use in the trial, is the one from Italy. Yes.
So, there are some trials like the one in Fibrogen that allows you to take it in.
Yeah, there is a trial that Fibrogen would allow you to, but others, because it's a phase 2 trial, and they will probably, tighten up on that later on. But we should be getting some results in the next 6 months to know if it is actually beneficial. So, there's been a lot of word of mouth things, but to really do it across section of population to know, is it really effective? So we're hoping it is, because it would be great if there's a cheap drug over the counter that you could take that would actually improve your outlook and your prognosis. And then how NAC affects people, it's a part of it is, they found, one of the other things they mentioned was the MUC5B gene, which is the one they found that's related to IPF. And many people who have that have problems with congestion or sinus pain, or always clearing their throat, or some kind of increased secretion problem. And because that NAC has some influence on those secretions, possibly that's why it delays. I don't know anything for sure on that, because we're still looking at the data and they haven't published anything. So,
was anything said about the thalidomide and cough trial, or was anything said about cough in general?
They, not in the medical sense so much. They wanted to mention that. They just mentioned it briefly, but they didn't go into the results of that. So I'm sorry. I don't know
anything else about cough?
No, just they recognize it's a problem, and apparently not recognizing it enough. So, but always keeping your throat, those usual things of having cough drops available and keeping your throat moist, as you know. But I'll go look about cough. We've talked about having a meeting on cough, and maybe that would be, we could find out, talk to the people who are doing those studies and do some more about it. So, any other question? Yes.
In the conference, are you aware of anything to increase the blood oxygen and carbon dioxide transfer rates or capacity? Is there anything out on that, or anything help increase the movement of oxygen in the body?
That wasn't anything they talked about specifically, but they did have some posters where people did, did different studies, but again, it's biomarkers. That's the big news. But it's as far as the transfer. That's the issue, isn't it? Because it's that damage to the lungs that keeps the transfer from happening. So we could figure that out. That is the key question. So another comment or question? So what other, yes?
Well, you mentioned a proper diet, proper diagnosis.
Proper diagnosis?
Your standard breathing test and the blood test and
Is that what you're talking
Standard
about?
test adopted, how accurate are they? Do you need more than that to know exactly where you're at?
Well, blood testing, they want...
About lung tissue or something like that?
So surgical lung biopsy, they've gone away from that. There's a classic look on the lungs. So if your lungs are classic with IPF, they usually have this, just at the bases of your lungs, the damage is where it occurs. And so what they say now, if you have that classic, they say don't do a lung biopsy. And that's just been in the last couple of years before. Before they would say, well, we really don't know, let's do a biopsy. But now what they're doing lung biopsies less because they're learning more about the patterns that they can see quite clearly on the high-resolution CTs. And so they can look at that and they're, because if you don't have to go through a lung biopsy, you don't want to do it.
Well, I don't want to do it. I just wondered, are these tests so accurate they actually know what's going on?
Yeah, and between your high-resolution CT and the laboratory blood test, so they can tell by looking at your blood, did you get that fibrosis maybe because you have rheumatoid arthritis or sarcoidosis or any of those other collagen vascular diseases? There's a lot of collagen vascular diseases that they can pinpoint, and where prednisone would be helpful because it can turn down your immune system. Whereas people that have IPF, prednisone, which we just proved doesn't help because it's not, it's a different process. They still think it's some kind of immunological process, but it's not the same as your typical, what they call the collagen vascular diseases, where people get rheumatoid arthritis and scleroderma and lupus, and all those things can damage your lungs just the same. I mean, the same. I'm sure once they get a medicine that helps scarring, it will help the people in those other diseases as well. But they're mainly looking, because they don't want to cloud the issue of people that have things that can be helped or slowed down or stalled. If you have lupus or scleroderma or sarcoidosis, those kind of damaged things are helped by prednisone, but or at least slowed it down. They can slow down that process. So, yeah.
You said they do have blood tests now, or is that something?
No, they do have the blood tests for the collagen vascular. So every one of you that I've read your records, you've been tested. And so they can do all those expensive blood tests to see if it was this a rheumatoid problem? Is this the collagen vascular? Because that way they would weed you out of the typical IPF. It wouldn't be that classic IPF pattern where they just don't know why. What is it? It's an outside thing that's coming in and causing this damage to your lung. Whereas the autoimmune illnesses, which IPF still may be one of those, but it's the collagen vascular panel is what they call that, where they do all of it. And so, so outside sources. But they can tell a lot. They now with the new things, they can tell a lot. And if you can avoid a surgical lung biopsy, and most of you had it, but don't do it just to know what flavor your lung disease is, because it's varying and there's a high mortality rate actually for that. So what are some other issues that you'd like to discuss? So cough at our. Do you want to look more at this? Or just talk? Okay, I'll do that to you. I went down and I said, you want to look at it, I didn't pay enough attention. So anyway, this is a very useful website, and it has so much. How to prepare for advancing disease and things like that, and we all should take a look at it. And so here she is again. Let's see this background. 57 minutes.
I think it started over on the download.
Yeah. It's down on the bottom there. So well, you can go to your own
They probably and wiki it.
boycott
We're
boycotting.
offline today.
Yeah, that may be it. So others can access information. But and any things that you'd like to discuss in our meetings in the future, or any strong feelings about? Any other questions? Anything you want to say to each other? Okay, well.
Excuse me.
Yes.
Some of your words don't come through very clear because of the sound system.
Oh, I'm
But
sorry.
were you discussing coughing?
Yes.
That's what I thought. Well,
Yes.
everybody here is going to be involved in how alarming about that. Do you have any suggestions along those lines? And in expectorating, you're going to have debris coming out of your lungs that you'll be spitting all the time. Is there any suppressant for that?
I am not an expert on cough at all.
Well,
So, but I know that they. You may have heard part of our discussion. There is a trial with thalidomide, that drug that they made pregnant women that took years ago that deformed babies. But they found that if you're not having children, that thalidomide is actually helpful. I think they decided that it was helpful, but I don't know all the particulars on that study, but we will definitely do something on cough, because I think it's one of the most irritating things that you have to deal with. And
John Hopkins was doing a study on whether or not thalidomide would help pulmonary fibrosis, and it didn't. The trial came out with that, but the people in the trial have said that it helped their cough. So then they've done a study on the cough, and they're not taking it. It's closed now. So, we're waiting to...
So it's still going on. I haven't followed that one.
Yeah,
So
but the interesting thing is how expensive thalidomide is.
yeah. Yeah, I'm sure thalidomide is very expensive. But so did you hear that? She said they're ongoing with a thalidomide study at Johns Hopkins, and they're seeing how that affects cough. So, yes.
I think unfortunately with IPF, you only stop coughing when they push you in one.
Yeah, that's...
You hope so, anyway.
You hope.
Personally, I think most of my cough comes from postnasal drip.
And see, again, it's that mucin gene.
I control that by drinking a lot of liquid. And I drink an electrolyte because I've ended up flushing out all my electrolytes and sodium by drinking, huge
Too
amounts
much
of
water.
But I keep the cough down by drinking a lot of electrolyte and using a nasal spray. Mostly just a saline spray I buy from Walgreens or wherever. And that keeps my mucus flow down and keeps my throat from getting irritated, and it's pretty well stops my coughing.
Okay, good. That's helpful. So, any other topics besides cough that you'd like to see in our next? We're trying to get for our next meeting. There's a lady who's a support group coordinator for the Moran Eye Center, and she's an excellent person, but she talks about dealing with life changes, and she's known for she's just an excellent speaker and excellent ideas about dealing with constant change in your life. And does that sound appealing to you? I know that's not a very good introduction to her, but they had a whole write-up on her in the university paper, and so we're hoping to get her to come and speak and just dealing with changes. Anybody have any other speakers that they think would be excellent to come? Dr. Sholin was sorry she couldn't be here today. They had a meeting and some unplanned things. Normally we meet on Thursdays, but we had to adjust to the availability of this room, because we can't do anything during the week at the university because of parking is so expensive for everybody, and so we do it down here, and it's free, and they're really nice to let us come. And it's